Here is a much asked question about the COVID-19 vaccine. Can you get COVID-19 after the first shot? Well, the answer is yes. And the local doctor you're about to meet was given the first dose of the vaccine 10 days ago and just tested positive. I talked with Dr. Sam Tarogi earlier this afternoon. He started by telling me about the side effects he had from the vaccine.
The day after I got the vaccine, I had a little bit of muscle pain and fatigue and headache, which I presumed it's a vaccine side effect, the systemic side effects. They were mild and they went away in a day. And after that, I was fine. I was doing my own thing, practicing social distancing still and PPE while I was seeing patients. But about 9-10 days after the first dose, I started feeling sick again. I came down with fatigue, headache, muscle pain, some sore throat, cough, all the COVID vaccines. And I was really a little shocked because, I have been treating COVID patients for about a year and I didn't get sick. But now right after the vaccine, is it COVID or not? So I had myself tested and unfortunately I was positive.
When did you test positive?
So it was yesterday actually that I tested positive and I self-quarantined.
How do you feel now?
I'm okay. I'm having a little bit of, chills and body pains, a little bit of sore throat and some GI upset, but they're primarily mild symptoms.
How did you distinguish between what was a side effect from the COVID vaccine and what was an actual COVID symptom? I'm guessing it's just the length of time because really you should only have side effects for the first 24, 48 hours, right?
Exactly, yeah. It's very important to know how to distinguish between these symptoms because there's a lot of overlaps between the symptoms of the disease and the vaccine side effects. And it's very important to know that the side effects of the vaccine usually go away in 24 to 48 hours after the vaccine, max few days. But if it's very far out from your vaccine and you are still having symptoms, or your symptoms are more severe than expected, or they're actually becoming more severe when time goes by, you should make sure that you test yourself because it could be the disease itself. And also another point is if you have had any suspicious contact with someone who might be COVID positive or you were in a crowd and you are having these symptoms, you should definitely test yourself.
As a teachable moment for others that the first dose isn't going to necessarily protect you. Can you talk about that?
Yes, it's a great point. Studies have shown that these two vaccines, the Pfizer and Moderna, they start kicking in and actually being effective after 1 to 2 weeks after the first dose of vaccine. And we expect only about 50% effectiveness after the first dose. And when you get the second dose, after that, we expect about 94 to 95% effectiveness.
Dr. Tarogi also suggested that even after you get both doses of the vaccine, you should continue to wear your mask and social distance. We should also mention that the doctor has a YouTube channel called Chatter Docs, where he educates people about medicine and health. He says he'll definitely be adding this.